Hello, everybody. As you can tell, I am the Braless Entrepreneur, and you are here for the Braless Entrepreneur podcast. Now, where did I get this fabulous name? Because I like making millions of dollars at home without a bra. All you got to do is tip up your monitor, right? You can't see my tatas right now. And as you get older, they get lower, and this gets easier, right? It's amazing. So, I'm going to tell y'all what's going on with me and who I have on today. I have Dr. Yen, who I searched for high and low, and she is the owner of pandiahealth.com, Pandia health.com. She's going to tell you all about it. First, Dr. Yen, please say hello.
Hello. Thank you so much for having me here. I love the braless. As you hit menopause and no F50s, it's like braless is very awesome.
It's so fantastic. I've loved being braless for a long time, but now that I get to work at home, I can really embrace this life. Okay, so here's my situation. I'm 52 years old, and I would say about a year ago, I started having hot flashes, right? And I was like, it's no big deal. I researched perimenopause and I've read a lot. Dr. Yen's going to educate us today. I read a lot about people going through this, like starting in their 30s. I'm like, dude, I'm totally lucky. This is not so bad. So a year ago, hot flashes, and then more hot flashes. And then they were waking me up 3 times a night. And then they started happening during the day. And I have an amazing husband. So I started traveling with my hair, my hairband. He put it in his pocket, and I would do this when I'd have my hot flash. And then my best friend Maria showed me these. And so then I got 3 of these fans, which was really, oh, it feels so good. It was amazing. And then I stepped it up some more and I got this ridiculous looking fan, which by the way, I should tag it. It's $8 on Amazon. And I have
That is a
3 of them, one
deal.
in the car, one inside. And it looks ridiculous. Somebody asked me if it was like a cup holder for beer, which I guess it could be, but it has 3 speeds. Y'all, it's $8 on Amazon. It's the best ever. So this just got out of control. And I started having hot flashes 3 times an hour and it was
Wow.
kicking my ass. So what did I do? I went to the doctor. I went to 3 doctors and they did nothing. Number one, they were men. Number two, they were like, it's fine. HRT is dangerous. It'll be fine. And it really pissed me off, like really pissed me off. So what I did is I went online and as a woman who mentors entrepreneurs, I wanted to find a doctor who was a woman. And I hope this is okay to make this assumption that was not 20 years old that had maybe experienced or understood firsthand what I'm going through, and that was an entrepreneur. So I found Dr. Yen with pandiahealth.com, and she educated me. And so this show is called How to Go Through Menopause, Perimenopause, and Not Kill Anyone, right? So that is the title of our show. And I'm going to ask Dr. Yen a million questions. And then if you want to talk to her and her staff, you got to go to pandiahealth.com. This is the Braless Entrepreneur. Let's get into it. All right. Dr. Yen, tell us your life story first. Let's unpack this. Don't you love when people on podcasts say this? Let's unpack this. First of all, where did you come from? Like, what's your backstory?
So I am a proud Taiwanese American.
Mm.
I was born in the heart of winter in Chicago. My mom was a nurse. My dad was a PhD student. They were so starving poor that my mom sat in the car contracting until midnight because they want to save money on the hospital days. And then at midnight 01, they went in the hospital. My mom a nurse, so poor, but knew the OB-GYN that delivered me, and he comped the delivery at literal African American, but a professor at University of Chicago comped the delivery because poor, grad student and his wife couldn't afford the situation. And then I was shipped off to Taiwan for 2 years where my aunt took care of me. Her youngest kid was 18. And so she had experience raising, I believe, 4 children. And so I was like a fifth extra or maybe a pseudo early grandchild. And then after a couple of years, she's like, why don't you just have another child? I'll keep Sophia. And my mom was like, no, came and grabbed me. And then have been in California since about kindergarten,
So
pre-K.
why did they send you to Taiwan? Like, so they could finish their education and like have enough money to raise you kind of thing?
Exactly.
Wow.
Exactly. I can't imagine my sibling being like, here, take my kid at age, 1 and raise this
Right.
thing for 2 years. I'd be like, are you out of your mind?
It's amazing. Okay. So like kind of a cool beginning here. Okay.
Yes.
So like when were you like, I'm gonna be a doctor? I'm that fancy and I'm gonna go get this education that takes a million years and is super expensive.
Yes. As you may or may not know, being an immigrant, being Asian, your job opportunities at that time were doctor, engineer, and I
Mm,
don't know what. It's a PhD. And so I like people and I like
yeah.
science. And so doctor was the way to go. I started it, my kind of entrepreneurial slash doctor side of me started in 4th grade scamming my parents to give me more stickers because stickers was a thing. And so
Yeah.
I was like, well, I can't just have one sheet of stickers. I need 3 or more because patients will take one and then the next patient will be sad. So I'm collecting stickers, not for me, but for my future patients. And so then I was
Hmm.
able to get 3 times the amount of normal stickers because of this excuse. But I've known I've wanted to be a doctor since 4th grade and I've stuck to that ever since, going through, local high school, public school, and then freezing my butt off at MIT. And then I was like, never again, East Coast, just too cold for me. And
So
then
you graduated from MIT?
I did in
You're
a,
so fancy. I know this is off topic, but yesterday I read, and I just want to know if you did this, that MIT offers a certificate in piracy. You can be a pirate if you take 4 certain PE classes. Did you do that?
I did not. I did not know about this, but I'm not
Yes.
surprised.
It's
That's kind
amazing.
of
So
awesome.
I haven't met a lot of people that went to MIT. I knew you were a
Ah,
smarty pants, but holy crap. That's awesome. And did you love
thank
it
you.
except for being cold?
The funny part is my eldest daughter was looking at the college situation, and I was like, ooh, what if she got into MIT and Stanford? What would I say? Because Stanford's her number one choice, but alma mater, MIT. And I was like, MIT was hard. But what I loved about MIT was the students came together. It was
Yeah.
a us versus them mentality. The
Yeah.
teachers are trying to kill us with all this information. The analogy is the fire hose of information that they spray at you, and you're trying
Right.
to catch as much as possible.
Yeah.
MIT was deeply humbling, but also taught you are not the smartest in the room. There is always someone smarter, and don't be afraid to ask for help.
Yeah.
That
I
is the
love
key.
that.
There's no shame asking for help. And so, what I hope people know, and I hope I teach my children, is that if you're banging your head against the wall for 20, 30 minutes, it's not you. It's the material, it's the way it's being taught. My father taught me this too. It's not you, it's the teacher, it's a
Yeah.
textbook. And if you're banging your head more than 20, 30 minutes, leave it and have somebody else explain it better. Or
Hmm.
always check 3 resources. So he's like, if this textbook doesn't make sense, try a different textbook that may explain it in a way that hits you better. And so the MIT, you walk in, I got my first test back and it was a 30. And I was
Oh
like, 30 out of 100? That's
my
like a
God.
sub F. I don't even know what that is. And I was just going to die. And then you learn about class AB and standard D. And it turns out that, class AB was 20 plus or minus whatever. And I was fine. But
Okay.
like somebody always gets a 60. Somebody always gets a 70. But at MIT, the average is like 30. So there's like 70% I didn't understand on that test, or
Wow.
70% more I could have learned. And so MIT is always about challenging you, and it isn't the answer that's gets you the points, it's the thought process of getting there. And so every test was open book, which I loved because I mean, we always life is open book. And so we have the internet, we have books we can look into, and it's about taking that information and processing it and coming up with that process and the answer versus just the number at the end. And
Yeah.
so partial credit, show your work, but practical, like okay, we want you to prove this given these two parts, design an experiment. And I was like, this is the way, because this is the reality. I got to design an experiment to prove scientifically this point, not just what is the point, right? I mean, our goal is to find that, discover that, and put that out. And so I love that. But my joke is if MIT had its reunions in New York, California, Las Vegas, San Francisco, or Hawaii, I'd go. Because it's in Boston, not a fan.
You're passing. You're not going to do it. But
Only for
this
the big
thing,
ones.
yeah. So this thing of being able to ask questions and having a respect for that, is that why you're so sweet to patients and patient about them asking questions?
I think that, part of being a doctor is you want to do good in this world. And a positive attitude towards that, the way I've seen it is each person has their story, right? And so with each patient, they're sharing their story, they're trusting you. And I'm bringing my knowledge of science and drugs to help make their life better or to make sure they maintain a great quality and function until their last breath. Our goal now is no longer to live as long as possible, but to live as healthy and as functional as possible. There's no point living if you aren't functioning, if you're miserable, if the parts don't work, and so we want to help maintain and give you that best possible life.
I love it. All right. Tell us about Pandia Health. What does it focus on? Why did you start it?
So I originally am an adolescent medicine specialist. So I did pediatrics, and then I doubled my education to specialize in what we call sex, drugs, rock and roll, a little acne, some sports medicine.
Love it.
And as being an academic, focused in on birth control, preventing unplanned pregnancy, realizing we can use birth control not for birth control, but for #periods optional. So anybody who's bleeding every month, if that sucks for you, if it impairs your school, if it impairs your work, if it impairs your sport, know that we can turn that off and that it's actually better to have fewer periods. It's better to have stable hormones. It decreases your risk of ovarian, endometrial, colorectal cancer. But all that to say, I started Pandia Health to prevent unplanned pregnancy. Our goal is to get you birth control and you never run out on our watch. And so first was just deliver it. And then we ran ads. Free birth control delivery. And 60% of the people that responded to such an ad did not have a prescription. And I'm like, do you not know you need a prescription in the United States? You can't just go and pick a pill, blah, blah. And also you don't have the knowledge that a doctor has in picking the best pill for you. And so I was like, fine, I'm a doctor. I will write the prescription. And thus the beginning of Pandia Health with asynchronous telemedicine. You can start care and get care within one business day. And then a pharmacy, if you already have a prescription, we ship it to your door. No one runs out on our watch. And we remind you 2 months before the prescription runs out, go see your provider. 1 month, go see your provider. 1 week. Okay, if you can't get into your providers, use us, And then I hit menopause. And all my friends were like, mad. And I'm like, yes, I will find the best treatment for me and I will make sure I get it because I need it. And then I will share it with you. And in building our 100% physician team, we're 100% doctor providers, no NPs, no PAs, no diss on them, but just I know doctors. I know how to run doctors. I don't know how to run NPs or PAs. And we have 2 OB-GYNs with 20 years experience each in menopause, which is rare because, as you alluded to, the medical community just let go of menopause for 2 decades because of this one research study that freaked them out about cancer, which we will hit next. And I was like, you specialists, you develop the algorithm, you tell us, teach all of us, train all of us, and if we have any questions, we'll consult you. And that's how Pandia Health was born. Pandia is the Greek goddess of healing, light, full moon. And then I also made up the definition because spelling correct, we'll always try to change it to Panda Health. But it's Pan is every and Dia is day. We want to be with you every day from your first period until your last breath.
Wow, I love that. That's some deep stuff there, Dr. Yen. All right.
Thank you.
So when I went to traditional, older white male doctors. Why did they tell me it was fine and there was nothing really to do and that?
So, the Women's Health Initiative in 2002 was a large research study, one of the largest at the time, to do a randomized clinical trial of putting women on HRT and not on HRT and comparing the differences between the group. The key is to know there were several flaws with the research study. Number one, the average age of the woman in that study was 63. So these women were starting HRT at 63. We now know that there's this timing hypothesis or window of safety / opportunity, which is we now recommend you start HRT within 10 years of your last menstrual period. And so the average age of menopause, your last menstrual period, the 1-year anniversary of your last menstrual period is 52. These women were started at 63. So that's flaw number one. Flaw number two is that they use meds that we generally no longer use as much. And so they used conjugated equine estrogen, which is pregnant mare's urine. That's why it's called Premarin. They take a pregnant horse, their urine, and they're like, here's a whole bunch of estrogens. Let's give this to women. So it's not a pure one thing. It's a glob of a bunch of stuff. And some of it horse that doesn't translate to woman that might have side effects or other effects that are unnecessary, right? And then they used a synthetic progesterone, medroxyprogesterone acetate, which is very strong. It's used in Depo-Provera, which is a birth control that you inject every 3 months, and it has side effects. And so we now use bioidentical, micronized, FDA-approved, FDA-tested progesterone. It's kind of the standard. And
So it's not horse. Did you say horse pee?
Yes, pregnant horse pee. That's why it's Premarin, pregnant mare urine. It's a brilliant name, but
Like, you know what would work for women? Horse piss. Like, what? Okay. Did not know that. Thank you for that. Please continue.
Yes. So a lot of people like natural, and that is natural for a horse.
Yeah.
So then this was the smartest, the best, the brightest researchers ever come together on this one research study. But there was a small group who were like, too many women are on HRT. Pharma's just pushing drugs down people's throat, which I sometimes agree with. But in this case, I don't know if it was the case or not. Probably because drug companies have always been doing it. And they're like, as soon as we get a whiff of anything, we're going to shut this all down. And so they got a whiff of people who were taking this protocol had a greater risk of breast cancer. But the key here is that it was 8 out of 10,000. So the way I like to think of it is 9,992 people benefit and 8 people also benefit, but 8 people get breast cancer. And however, know that in today's time, we're very good at detecting breast cancer and very few people die from breast cancer. And I agree that chemo is horrible. I agree that if you chop off your breast, that's not cool, but it's better than dead. And also it's better than suffering from hot flashes, night sweats, brain fog, etc. So 9,992 benefit, 8 benefit, but also get breast cancer. And then we now have 10 and 20-year follow-up on this research study. And this is the kicker. There was one group that only had estrogen and one group that had estrogen and progesterone. The progesterone is because the estrogen stimulates the lining of the uterus and can increase your risk of endometrial cancer. So if you have a uterus, you have to have the progesterone. You can't up or down. You shouldn't down it, because if there's not enough, then you have an increased risk of endometrial cancer. But in this group, they didn't have uteruses, because one of the top surgeries in those of us born with a uterus is take out that uterus once we're done having babies, because it has fibroids, endometriosis, take out the ovaries and the tubes, because that increases your risk of ovarian cancer. So they just like to take it out. It's easy. I don't have to worry about it, you know. And so in the group that only had estrogen, 10-year and 20-year follow-up, they had 22% decreased risk of breast cancer, 44% decreased risk of dying from breast cancer if they got breast cancer. So that proves in the conjugated equine estrogen, even with the pregnant mare's urine estrogen, it decreases your risk of breast cancer. So one
Interesting.
question you can ask to see if your doctor knows the latest and greatest is, does HRT estrogen increase my risk of breast cancer? And if they say yes, fired. Or here's the book Estrogen Matters, which is written by Dr. Blooming, an oncologist whose wife and daughter both have breast cancer. So he is passionate about breast cancer and estrogen, but his key is debunking the problems with the Women's Health Initiative and the evidence showing that it's not so much the estrogen. We now think it's the synthetic progesterone.
Okay. So I'm going through perimenopause. I'm 52. I'm right in it, right? Hot flashes, couldn't sleep. Recently, I saw a woman doctor, right? Who I really appreciated, who was not 20. And I am now on a patch and hopefully I'm getting this right, low progesterone, like birth control pills. Um, it's been great. In 3 days, I had less hot flashes. In 2 weeks, I had no hot flashes. She told me there were
Awesome.
other options, which I'm now interested in because it's been a month and I have gained 9 pounds. So in the past, whenever I took birth control pills, I am just a ravenous piggy and it is back. And I ate a giant hamburger at 8 o'clock last night and I don't know what's up. So like specifically, I'm interested. There's so many things that I can tell already. I'm going to have to ask you for an episode 2, but I'm interested. Like she talked about different options. IUD, she said was an option.
Yes.
I have had an IUD and it sucked because the pain of putting it in and taking it out is bullcrap, in my opinion, right?
Yes.
My daughter, when she had that, and it was for health, to reduce periods and pain, they put her to sleep actually, which why don't they do that for everybody?
So, number one, when you get an IUD, Dr. Yen's tips: go on your period if relevant, because the hole is already open, so they don't have to push anything through a block. If there is a block, it's just a cervical mucus block, so it's no big deal, but why not have it open? Don't go on the first day when a whole bunch of stuff wants to come out. Go on the second or third day or whatever, how long your periods are, right? Towards the end, if you can time it, right? Like some of us are, our periods are weird, and so that's hard to time. Number 2, take 600 milligrams of ibuprofen half an hour before. You'd be like, oh my gosh, ibuprofen makes people bleed more, which it does, but it also is a very good muscle kind of relaxant prostaglandin situation with the uterus. And according to our UCSF anesthesia rotation, 800 milligrams of ibuprofen is equivalent to a gram of morphine. So it's good stuff. You just gotta take it ahead of time. And then lastly, ask for a paracervical block. So they used to be like, we don't know if the uterus hurts or not, so meh. And I was like, well, if you don't know, let's err on the side of assuming it hurts,
Yes.
And some doctors like, well, it takes too much time, blah, blah, blah. And I was like, again, do you want me to poke you with no anesthesia, or would you want me to numb it up to be safe? And so definitely ask for that. The reason why we don't recommend general anesthesia, except extreme cases, is because every time you go under anesthesia, you could die. Not that it's a very high thing, but why risk that? Also, you got to book an OR sometimes. There are some people that can do in-office sedation with a little nitric oxide, like at a dentist's office. But again, you have to have an anesthesiologist, or you have to be willing to take on that risk. You have to have a crash cart. You have to have some oxygen in case things go south. Because again, 1 in 100, 1 in 1,000, 1 in a million might go that way. And so
what is this paracervical block? What is that?
Yeah. So you have your cervix, and para just means around, and a block is lidocaine. So lidocaine numbs anything. If you don't know, on the condoms that help men last longer, It's actually lidocaine. It's numbing their penis so that they can last longer, because the penis always gets off. But if you numb it, then it takes more effort, longer time.
Because you can't feel it as much.
Yeah.
How fun is that?
Yeah. It's not totally numb. It's just a little numb. You know what I mean?
Sounds lame.
I think it's hilarious that's how they make you last longer. But the paracervical block is lidocaine injection into the cervix.
Well, how much does that hurt? Getting the injections, does that hurt?
Well, the whole reason they don't numb it up is because theoretically the cervix doesn't feel stuff. And so I mean, if you saw the tenaculum that they use for the cervix, you do not want to see the instruments. These are like from, I don't know, 1920s or something. They're like pincer fang that they grab your cervix, pull it, and then that way they can move it around. Someone has created a new one, which is a suction one, which is smart. But then you might end up with a hickey, later on your cervix. Not that anyone's ever going to see your cervix. Other than the doctor and maybe yourself if you're really into it with the, but you need a speculum and a mirror.
Yeah.
But
so, okay, let's talk about me gaining 9 pounds in a month. I mean, and I've always been like that on birth control. Always.
Yeah.
So I'm hearing for HRT,
options.
There's lots of options. Can you tell us about those options?
Yes. So one key thing to know about perimenopause, it is the 4 to 5 years on average. Those if people deviate, but 4 to 5 years is the standard leading up to that 1 year anniversary of no period. Yeah. Know that there are 2 parts of perimenopause. So we're getting in the weeds now. There's early perimenopause, which is the first part, and then late perimenopause, which is the second part. Early is not, I got it early, late, and I got it late. No, in this case, early is that first part, half, and then late is the second half. In early perimenopause, your ovaries are like, last party, last call. It's like, pew, 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 pew. And like normally it's every 28 days, every 35 days. But at this point, chaos. It's like, pew, 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 so it's not regular. And when they stack up on top of each other, then you got estrogen on top of estrogen. So I like to think of estrogen as bricks and progesterone as mortar. And so if you have too many bricks and not enough mortar, they're going to fall off and you're going to have irregular bleeding. And if you have giant stacks of brick, you're going to have what's called the flood, murder scene bleeding and all this stuff. And so during this chaos, I much prefer to take over the ovary and be like, you be calm, you be sleepy, you not pop crazy, you don't create this estrogen and chaos, and we will supplement with synthetic estrogen and progesterone until you're done, and then we'll replace with bioidentical. And so until that last pew times 1 year, because at any time you could pew again and then you could get pregnant, you need contraception. And so that's why you have to, if you're sexually heteroactive, need contraception for 1 year after that last period, or, just until you're free and clear a year from your last period.
Yeah.
And then 2, I prefer to turn off the ovaries so they're not doing their crazy thing, so your hormones aren't chaos and up and down, and then switch over to HRT when we're seeing less crazy and maybe more need for the bioidentical. And the example I give is, you heard me allude to, I love #periods optional. I have a TEDx at the bottom of pandiahealth.com/periods optional on the science and safety of not bleeding every month. And I was personally periods optional since my last child 16 years ago, no period whatsoever. But then I knew I'd entered late perimenopause or perimenopause, because my waist disappeared and my cholesterol shot up. And so that's what happens when you take away estrogen, is the fat goes to your waist. It just distributes centrally. It goes, I'm an obesity expert as well, it goes to your heart and it goes to your liver. And as an obesity expert, when I'm like, it goes to your heart, I'm like, if that's what happens, then you put it back, because cholesterol and heart means heart attack. And I do not need or want heart attack.
Right.
And so when the weight gain is, part of it is like aging. And my doctor gaslit me when I showed up at age 52 as a physician on constant birth control, no hot flashes, no night sweats, because I was on the birth control, preventing the up and down chaos, which is what causes the hot flashes. Yeah. But My waist disappeared, cholesterol shot up. She's like, oh, that's old age. Just need to exercise and eat better. And I was like, I'm an obesity expert? People wait 6 months to see me. Nothing has changed from last year to this year, but my
Right.
waist is gone and the cholesterol is off the roof. And then I switched over to HRT after I got educated on HRT. From the birth control to that, waist came back, cholesterol went better, but they also put me on a statin. Those of us that want to live forever, I recommend you stay on a statin, just like don't come off. I could come off to see if it got better on the HRT, but like there's no harm. The joke is there's not too low of cholesterol ever. And so that is to say that the gaining of the weight could be a side effect of the birth control, though most people in research on birth control pills do not gain weight. But if you notice when you go on a particular synthetic progesterone in the birth control pill, it gives you the munchies and you gain weight, then for you, that is a bad progesterone. Know that there are 8 different progesterones and you tried one of them. Let's try the other 7 and see if that has a different effect on you. But
And
the
when you
other
say the
part,
other 7, do you mean
yes.
other pills or other what?
Yes. So
Other
that's the
pills.
thing I love about the pill is the pill has 40 different options, but the IUD just has one, levonorgestrel, and either your body likes it or your body does not. The implant is an amazing birth control option, but it only has one option. Either your body likes it or your body does not. Depo-Provera, one option. Like body likes it, just as an aside, that one absolutely gives you the munchies and generally do not recommend that one. Well, again, anything is better than pregnant when you don't want to be pregnant. And you
Damn
certainly will
right.
gain far more weight pregnant and you will lose calcium pregnant than you will with the shot. Those are the 2 side
Yeah.
effects of the shot. Makes you gain weight, munchies, and can hurt your bones, but it gets better when you come off.
Yeah.
But the pill, you have 40 different pills, different levels of estrogen, and 8 different progestins at a minimum. The cool part is at this age, there are 2 birth control pills and birth control ring that have been neglected that have now appeared on stage that could be useful because we're older, we can afford it a little better. One is Nextstellis. It has a bioidentical estrogen. And then I forget what progestin it is, but it's a pretty good progestin that's in that one. The negative of that one is some people have seen more breakthrough bleeding, but it is bioidentical. The other one that is, usually not considered because it's expensive, but thanks to the Affordable Care Act, no copay, no deductible, supposedly, thanks to Obama Biden for any FDA approved birth control, is Anovera. So it's a 1-year ring with minimal ethinyl estradiol, 13 micrograms versus the normal pill is 30. Another one is 20. And then the low is 10. This is 13. And it's in your vagina. You could take it out when you have sex, but most people with penises don't mind it and it doesn't bother them. And you don't want to leave it out more than 3 hours or else you literally be screwed if you had sex and it won't work as a
And
birth
if you're
control.
having sex for longer than 3 hours, like congratulations, first of all, like way to go. Last question. When you say HRT, hormone replacement therapy, is that a catch-all phrase for the pill and the patch, or is it something completely different? I don't even know.
Yes. So I think the definition is in evolution. Generally, when we say HRT, we mean the bioidentical, FDA approved, FDA tested estradiol and micronized progesterone or some sort of estrogen progesterone. There's synthetic progesterone. There are synthetic estrogen combo pill, but generally we like the estradiol, not the ethinyl estradiol when we're talking about HRT. But I
What is
also have a
estradiol?
TikTok.
Is that a pill?
There is a pill that combines estradiol and the progesterone, but generally we are not a fan because when you take the estradiol by mouth, it goes through your liver and that increases your risk of blood clots. But it's a small increase in risk, and if you are totally clean arteries, no cholesterol, no blood pressure issues, then you could consider it. But most people like the transdermal, which is the patch. And there's a once a week, there's a twice a week patch, and then there's a gel, there's a spray, and then there's also the underutilized 3-month vaginal ring that can
Right.
just deliver it. So these are the options that are not going to have as much blood clot risk. But again, it's a minimal blood clot risk, but it is there with the oral.
All the options you just came up with, is that when they go to Pandia Health and they work with your team, are all of those options explored?
Yes. So
Okay.
we will allow any, option that is FDA approved, FDA tested. What people need to realize is that bioidentical is a marketing phrase. When
Okay.
when the public and TikTok is saying bioidentical, they are implying compounded or they are implying pellets. And I want everyone to know that the American College of Obstetrician and Gynecologists, the Menopause Society, which covers North America, which is Canada and us and maybe Mexico, and then the Endocrine Society, all do not recommend compounded and absolutely do not recommend pellets. And people think that pellets are okay, but these are things that people put in your buttock and it's there for 3 months. And once it's there, there's no way taking it out. And because they're individually compounded or individually made, they aren't FDA tested, FDA approved. And so that is not the standard. The standard is we have options with the FDA approved, FDA tested, and the FDA approved, FDA tested are bioidentical.
Dude, I've never heard of pellets in your butt. I've never heard of any of this. And all of my friends are 50 something, and I bet you they've never heard of it too. So we're going to schedule another episode. If you're up for it, I want to hear what all the options are out there to get through perimenopause and not kill anyone. I don't have rage, but some of my friends have just full on rage. I want to get into that next time.
Yes.
Um, but thank you so much. And just one more question. So, Pandia Health definitely deals with perimenopause and menopause. Are there other areas, like, you still focused in the no periods and the birth control? Like, what else do you do?
Yeah, so we are not here to take the place of your primary care, but we are here to supplement in areas they are not educated on or aren't the best and the brightest simply because we focused on birth control. So I am like the goddess of the birth control pill. We came up with an algorithm for picking the best birth control pill with 93% of our patients happy with the first pill prescribed. 93% of our patients are happy because I came up with this algorithm how to pick the best one because I came from MIT, UCSF, and couldn't help but like, women are suffering. Let's come up with a better way of picking that best pill. And so we still absolutely provide the birth control pill patch ring, and this can be used as HRT for the early perimenopause patient whose hormones are chaos. So check out my TikTok, Dr. Sophia Yen, Dr. Sophia Yen, and Insta, where I have a video on that. And
Yes, we
then
need that. And we're going to link all that,
I love it. And
please.
then we do the peri/menopause for the FDA approved reasons, which are hot flashes, night sweats, genitourinary symptoms, so painful sex, painful relations, feeling like you have a urinary tract infection when you don't, having urinary tract infections when you didn't used to have it, particularly important for our moms and our aunties out there that are like 60, 70 and above. That's when it starts to hit. And then lastly, at risk for osteoporosis. So my joke there is that most of us are at risk for osteoporosis. If you aren't very good at your calcium and vitamin D, like most minorities aren't, then you are at risk for osteoporosis. If your mom has osteoporosis, you are at risk for osteoporosis. If your auntie has it, if your sister has it, all of that. Those are the things we can prescribe for because we're asynchronous. We don't want to get sued. We don't want to lose our license. But know that if I give you estrogen and progesterone, it's going to help the 100+ symptoms of peri/menopause. But legally and for my company, we can only do these 4.
Okay, fabulous. All right, everybody, check out Dr. Yen at pandiahealth.com. We're going to have all the links posted here below. And she's coming back because she has props. And I want to get into props and I want to learn more about pellets in your butt, which I don't plan on getting those. And so I definitely want to hear more. Thank you, Dr. Yen, so much for being here. Everybody, you can check out all the episodes at ditchthebra.com. And thanks for tuning in to the Braless Entrepreneur.